Hi, I'm Jeffery Flash. I'm with American Foot and Leg. I've been with the practice for 15 years. I'm board certified in foot surgery by the American Board of Podiatric Surgery. I specialize in all types of forefoot and rear foot reconstructive surgery as well as general podiatry. Heel pain is quite common in the general podiatry. In our practice, it accounts for roughly 30 to 35% of patients on a daily basis. Most common symptoms of heel pain is pain first thing in the morning, arch pain, pain in the heel. This can be mild, moderate, and severe. It can be from an achy pain in the heel to severe pain with every step you take. Primary causes of heel pain are typically inadequate arch support or lack of good support in appropriate shoes. This can be aggravated by certain types of jobs, such as patients that stand a lot throughout the day. The most common symptoms of heel pain is pain first thing in the morning when they first stand and get out of bed, as well as pain throughout the day in the heel and into the arch. This can be aggravated by certain job types, such as factory workers or patients that stand a lot throughout the day. The first thing we do with patients with heel pain is always attempt conservative treatments first, which consists of icing the inflamed area, stretching the ligament, arch supports, anti-inflammatories, which are like Motrin or Advil, night splints to help stretch this out, and in some severe cases we use steroid injections to help reduce the inflammation of the region. For resistant cases, sometimes surgery is needed. Recently, PRP has replaced this in our treatment regimen for chronic plantar fasciitis. PRP stands for platelet-rich plasma. The platelets are a component of the patient's blood. Therefore, we harvest some of the patient's own blood and we spin it down to get a concentrated version of their own platelets. We then inject it into the chronically inflamed area to stimulate the body to heal itself. It has growth factors. So when you get cut, you bleed, it forms a clot, which is the platelets, and then 3-5 days later, the scab falls off and what? Your skin is healed. It's amazing. This is minimally invasive. All that is required is an injection of the PRP into the inflamed area. Aftercare is very simple, consisting of appropriate stretching, supportive measures with arch supports, and also the patient only will need 1 to 2 days out of work, typically. Some patients may require slightly more time, but not as much time as the traditional open surgery, which could keep patients out of work 4 to 6 weeks. The success rate for PRP at this point in time in our practice is 80% or better in my estimation. Most patients at 4 weeks are seeing anywhere from 60 to 90% improvement with nothing more than harvesting their own blood and re-injecting it into the inflamed area. Other alternatives to heel pain are surgery for resistant cases, but 95 to 98% of patients will respond to conservative measures and not need surgery. However, the patients that do need surgery, that do have open surgery, which means cutting of the tissue and cutting of the ligaments, will be out of work for 4 to 6 weeks minimally, depending on the type of work that they do. Also, there is more risk involved with an open surgery consisting of potential delayed healing, edema, which is swelling, and recurrence of the chronic plantar fasciitis if it does not heal well. Surgery is a last resort.